All right, so today we are talking about the measles outbreak that is happening not only in Florida but across the nation. Health officials in Broward County confirmed a seventh case of the virus, which is in a child under 5. And the key thing about this patient is that it's the youngest so far to be infected in the outbreak and is the first to be identified outside the Manatee Bay Elementary School area, where it's the epicenter of the outbreak in Weston near Fort Lauderdale. And while it's unknown what the connection the youngest measles case has to the school, it shows that there's not only spread beyond school age kids, in the area, but also sustained community spread taking place within the county. And as of Friday, reported by the CDC, there has been at least 35 measles cases in 15 states in 2024. And so while Florida's outbreak is expected to be the largest in the US right now, the way that the Florida health officials are handling it has gotten a lot of contention from the public health community, because the state's general surgeon, Dr. Joseph Ladapo, pictured up here, I believe, basically in a statement, he is going to let the parents decide whether to quarantine their children or let them keep going to school. And the main thing he is citing is, a lot of just like educational costs, that might come from not being in school. But the one thing he's really cited in this article that I'm very much concerned with is that due to the high immunity rate in the community, that is one of the biggest reasons why he's like citing that people shouldn't have to like quarantine their kids and all that. And the one thing I want to, highlight with that is that we have about a 93% overall immunity rate in the US in terms of just kids, kindergartners and stuff, when it comes to like, the routine vaccinations. Whereas we need to get to 95%, especially when you talk about very infectious diseases such as measles, as well as polio and all that. And just before we get into the whole thing about vaccination, immunizations, exemptions, and all that, I just want to talk about why measles is still very much a public health threat to this day. For one, it is seeking a resurgence from the past. A lot of people believe that we got rid of measles, with the vaccinations, when it was, first came out. But the thing about, vaccines are never meant to eradicate the disease. Let's just get that straight. Vaccines are not meant to eradicate diseases. It's not meant to be seen as necessarily like a cure, but vaccines are supposed to provide a layer of protection for you that if you come in contact with the germs of it, then you should be fine and you should be taken care of. We had it with polio, we had this with measles, we had this with the pandizzy, back of 2 or 3 years ago. And it's just one of those things where it's just like this misconception that if you get vaccinated you should be fine, or if you don't have to keep up routine vaccinations, or if your children have to keep up routine vaccinations, they should be fine. That is very much false, because just because you're not getting sick from a disease doesn't mean the disease is completely eradicated. Another common occurrence is that people think measles was like pretty much only centered around the US. No, measles is common throughout the world. Just giving these like lists of countries right here, Yemen has the highest number of measles cases with measles outbreaks. This was recorded from July 2023 to December 2023, basically just last year. They had 18,000 cases. Azerbaijan has 13,000 cases, 14,000 cases really. Kazakhstan, 13,000. It really just takes for one person to go in those countries, a person who is unvaccinated, most likely, you bring that back into the US and spread it among other people in the community that are unvaccinated. And to that point, it causes the outbreak that we're seeing right now. And now going to the actual long-term effect of measles, basically for every 10,000 children infected with measles, 2,000 will be hospitalized, 1,000 can develop a ear infection with the potential for permanent hearing loss, 500 will develop pneumonia, as well as 10 to 30 will actually pass away from measles. And it's one of those things where it's just something you don't play with, especially when you have like younger children around who are unable to get vaccinated, as well as yet children who parents don't want to vaccinate them. Like, this is very vulnerable, especially when you talked about children. Nevertheless, when you talk about other immunocompromised individuals, such as older folk, people who are unable to take vaccines due to some type of autoimmune history, or disease or something. And this is really something that you need to be serious about. Like, this isn't something you really want to play with, because not only does measles has like damage on your body itself, but it also causes immune amnesia, which the immune system losing its ability to fight in other infections that the patient was previously immune to. Basically, the virus wipes out about 11% to about 73% of a person's antibodies, the things that are used to fight, of other diseases. And basically it can leave patients open to opportunistic viruses such as the flu, bacteria, and things that cause pneumonia and skin infections, just for example. And so in years past we wouldn't be as concerned with measles because the vaccine rates were a little bit higher. For measles to be subsided, or really to have that sustained herd immunity in the community, you would need about 95% of the community to be vaccinated against measles. That is not where we're at right now, especially as CDC reported last year, the highest childhood vaccination exemption rate ever in the US was taking place, especially during the pandemic. And so looking at the actual report and not just the article, basically from 2019 to 2020 to 2021 to 22 school year, national cover with state required vaccines among kindergartners declined from 95% to approximately 93%, ranging from 92.7% for diphtheria, tetanus, acellular pertussis vaccine, as well as 93% for polio. What was added in this report is during the 2022 and 2023 school year, coverage remained near 93% for all reported vaccines, ranging from 92.7% of DTaP. Pretty much the same for 93% for measles, mumps, and rubella and polio. And the exemption rate increased from 0.4 percentage points to about 3%. Exemptions increased in 41 states, exceeding 5% in 10 states. Just looking at those 10 states right here, Idaho has the highest, it with 12%. Oregon is a close second with 8%, or at least 8%. Wisconsin 7.2%, and just surprising, in the South it has remained about 3.5%, 4.5%, 3.8%, and just 2% in Alabama, but it is expected to rise because how the South be southing sometimes. And basically there's a lot of reasons for this. One is just like the mistrust that a lot of people have in the healthcare system. Some of it is unwarranted, some of it is warranted, especially talk about Black and brown folks, with our experiences with the medical system, hence Tuskegee. But pretty much a lot of people just cite religious reasons, personal reasons for not getting the vaccine, not really understanding the science as well, not trusting the science, as well as the fact that a lot of people are saying that, well, we got the most of the country vaccinated, we should be fine. Which if the disease like measles wasn't as infectious and wasn't as contagious, that would be terrific. But when you have a very infectious disease, keep in mind measles, like I said, affects about 90% of the people, especially unvaccinated individuals. It comes in contact with serious illness. Then we get to a point where we need like 95% of the population to have the vaccine, to have immunity, to sustain herd immunity, and cut out the diseases wherever it might travel and stuff. And even if we dip below 93%, that leaves a lot of other people vulnerable, especially young kids who can't get vaccinated, who are unable to get vaccinated because of their parents' decisions. A lot of elderly folk, immunocompromised individuals, like I said before. It leaves a lot of individuals in the community that are unable to get vaccinated, really vulnerable to this disease. So that's why 50% won't do, that's why 60% won't do, that's why 75% won't do, that's why even 90% won't do. We need like 95% of people in the population to be vaccinated for us to really not think of measles as a threat. And because of the decline in kindergarten getting vaccinated remaining at 93%, that is very concerned that we're going to have another measles outbreaks, or we're going to have more measles outbreak that are more common because people aren't vaccinating their children for XYZ reasons. And now going back to the main article I cited, basically the way that Ohio got their measles outbreak under control a few years back, basically if you didn't know, about 85 kids were infected with measles. Most of them were unvaccinated toddlers. And basically what the state health department did was they gave two main guidelines and all that. And basically they said you need to encourage them to get the MMR vaccine, which offers 97% protection against infections, as well as keeping unvaccinated kids who've been exposed to the virus out of school, daycare, or other activities for 21 days and not leaving it up to the parents. And so while this wasn't a law, this wasn't an order, this wasn't like by no means like parents had to follow this by any means necessary. The way they communicated it in a way in urgency, they, you know, stated that this is a public health emergency. This is not up for interpretation. Like, this is the science. Like, this is what is going to happen. The parents followed suit, and that is the example that Florida needs to be going by now, by not letting parents be like, okay, if you feel like, you know, you're good, you know, we have a high enough immunity rates, we have a high enough of this, you know, high enough of that, you should be fine if you let your unvaccinated kid go to the daycare, you know, even though they've been exposed to measles, like a highly contagious disease. Like, Ohio did not do that. They did not leave that up for interpretation. So with that being said, that has been my coverage on the outbreak of what happened in Florida, the situation, how they're handling it, and, you know, just overall the situation in the U.S. By chance, if you are a parent that has not vaccinated your kids or have been vaccinated yourself against the MMR vaccine, please do so, because like I said, this is no joke, and I hope this video can at least like encourage you to like look at it from a different perspective. And so please, you know, just don't take this lightly. Get vaccinated, get your kids vaccinated, and just make sure to protect everyone else in your family and your community through this, you know, vaccination process. And if you're not a parent but you like the video today, please like, subscribe, turn on post notifications, all that wonderful good stuff. And also go see this video I posted a few days ago. Definitely a banger. But other than that, stay warm, stay frosty, depending on what part of the country you're in, and peace out.